Hi, my name is Laura. I'm a nursing student in 3320. Today we're going to be doing a GI and abdominal assessment. So first you're going to start out with all your basic nursing practices. Come in, knock, wash your hands, introduce yourself to the patient, have them identify themselves with those two identifiers. Wash your hands and provide some privacy. And you'll start. While you're doing that, you're going to be looking at their general appearance, how their demeanor, how they're acting, their general behavior, and then if they are, how they're positioned. Are they guarding their abdomen or one side or the other? Are they nauseous? Are they actively throwing up? Are they in a good deal of pain? So you'll be looking at all of that. And then you'll start by looking at their abdomen. So you'll start on the right side and you just kind of get down on the level of their stomach and you look from the top to the bottom and then top to the bottom on that side. You're looking for the skin color, any contour, any characteristics of the abdomen, any pulsations or any movement in the abdomen that shouldn't be there. Normally it's flat, there's no striae, there's no scars, any weird pulsations or irregular, anything like that. And then you're going to listen. So you listen with the diaphragm, which on mine is the bigger portion of my stethoscope. And you're gonna listen in all 4 quadrants for 1 minute. And you're listening for those gurgly sounds. So like that in all 4 of the quadrants. You listen for 1 minute, you should hear 5 to 30 bowel sounds per minute. Anything above 5, anything below 5 is hypoactive, anything greater than 30 is hyperactive. If you don't hear anything within that 1 minute in any of the regions, you're going to listen again for another 5 minutes. And then another thing you're going to listen to for is aortic brutes. You'll use the bell of your stethoscope, which is a smaller side, and you'll listen at the aortic region. And you'll do femoral on the left and the right, the iliac left and right, which is kind of like a little below the belly button, left and right, and then the femoral left and right. You'll listen for any brutes, which is that chaotic noise. You don't want to hear that. It's abnormal. And then you'll listen for a venous hum in the epigastric region, which is kind of on their right side, between the sternum and the top of their belly button. And you'll again use the bell. And you'll listen for venous hum, which is kind of like a low-pitched humming noise. So after doing all of that, you will then palpate the abdomen. Make sure if your patient has a history of organ transplants, or if it's a pediatric patient you're suspecting a Wilms tumor, you do not palpate. But you'll start with light palpation of 1 to 2 centimeters in all 4 quadrants. You're looking for any tenderness, any masses, any aortic pulsations, anything like that. And then you'll repeat that at 4 to 6 centimeters, just pushing a little deeper. Again, working in that clockwise motion. If you do detect any masses, you're going to note their location, their size and shape, their consistency, and if they move with their breathing and different things like that. So again, you're palpating for tenderness. Also be looking for non-verbal signs of tenderness if they start scowling or trying to guard. But tenderness, masses, aortic pulsations. And then you'll palpate their belly button. So find the belly button and palpate for bulges, nodules, or an umbilical ring. And then after that, you're going to check for CVA tenderness or kidney tenderness, and so you'll do that posteriorly. You find the angle of their ribs coming off their spine. You lay your non-dominant hand flat and then you percuss with your fist and you hit. So you'll do that on both sides. If he did experience any tenderness with that, we'd be worried about like pyelonephritis or kidney stones. No tenderness is good. But you'll do that on both sides, and that is it. Thank you.